Hello and welcome to another episode of the Health Notebook. Today we have a social worker in the studio, Chrystal Radebe, and she'll be giving us a little bit more information regarding the work of a social worker and what value they can add in terms of patient management as a whole, as an entity. Chrystal, welcome to the studio.
Thank you.
So if you could kindly just tell us a little bit about yourself, what you studied, and in terms of where you are in relation to your career.
As you've already mentioned, I'm a social worker. I have started my career being just a normal production social worker, and I work in an occupational setup, and thus far I've done patient care in terms of services to patients when they are admitted, but I've also done work in an occupational setup where I work in the organization per se, working with work-related problems, and also work development assessments, and then making recommendations in terms of that.
Okay, now in terms of your undergraduate qualifications, I'm sure there's many viewers that would be interested in becoming social workers. So if you could just elaborate a little bit what you've done in order to gain that qualification of being a social worker.
After matric, I have studied at the University of Stellenbosch, and I've studied in a BA social work degree, and from there onwards I have applied at many institutions, child welfare, the correctional services, and I've done also my practicals in such a manner that it almost set me up for industrial setup, for an occupational setup. So I also think that people that are studying social work should be mindful also where to do their practicals in terms of where they would find a better fit, because you get different specialities in social work where you actually can also specialize.
Now you've mentioned different specialities. Can you just elaborate or touch a little bit on some of the specialities? I think people out there have different perceptions in terms of a social worker. They normally assume a social worker is coming to their homes when there is maybe a child-related issue where they're suspecting abuse or something like that. So can you elaborate the different specialities?
Yeah, I think that the perception is when people hear social work is to remove a child.
Yes.
Yes, from people's home. I think there's nothing wrong with that, and that you have different settings in social work. Like for instance, I work in a medical setting, and then you have your occupational setting. Your medical setting can also have a balance with occupational setting as well. And then you have like a child development setting, which includes your child welfare organizations with PADISA, but also anyway. And then you also have your correctional services setting, but that also includes again a little bit of each. It includes a medical setting because they've also got sick bays in the correctional services, and then they also have staff that you work with, and then you also have your inmates that you work with. So there are different settings these days for social workers in which they can specialize, and a lot of social workers have their own private practices where if their strength is children, then they what they call specialize in care for children. If your field and your specialization is in marital and relationship counseling, that is then a field in private practice that you can specialize in. Adoption care is the other form of specialization in the field of family and child care that you can also specifically focus on.
Okay, so there seems to be this broad specialization.
Yes.
Okay, so let's take, for example, the common one. In terms of visiting the home where there is suspected child abuse and things like that, what would be your approach to a situation like that? Just some basic fundamentals, and then we can maybe look at another area, as you've mentioned, relationship and marital issues as well. Okay. So what would be your approach if you have to go into a home to assess the situation over there?
We will get a referral sometimes from the school, and you can also get a referral from the neighbors. You can even get a referral from the church. So it depends on also where you get your referrals from. But it's always good to go and assess first. And if you get a referral like that there is a possibility where a child, for instance, is exposed to child abuse or any form of violence, then it is always going good to see in the home environment also where the child is staying, to have an interview with the parents, because one should never just assume that the referral is per se abuse.
Okay,
Yes.
so you sort of get your information from different
Data
sources. So one
gathering.
would be
Yes.
from the school, the
Yes.
other one would be from the child
Yes, from the
herself or himself,
Yes.
and then obviously from the parents and other collaterals as well.
Yes, the collaterals is very important, and you can even, what they call, if there is suspicions of, say for instance, possible rape, then also your doctor, your GP, is also what they call a source of information that would also provide collateral to your assessment that you've done.
Okay.
And even the police, the child protection unit also plays a pivotal role when it comes to our referrals.
Okay, so you sort of work independently and you also work part of a multi-professional team as well.
Yes, if for instance you were working in a medical setup, a hospital for instance, and a referral has come through the hospital to the social worker, then again there's a multi-professional team where a social worker would be involved, the doctor would be involved, and then you also look at the age of the child, because pediatrics doctors will then be involved in that assessment. And it is also important that the parents again be involved in the whole process. In my setup, for instance, I would not what you call deal with the statutory part of the child abuse.
So that's the
yes,
legal implications.
Yes,
Okay.
yes, yeah. That would be referred, what you call, to an external social worker. What you call, whether it's a child welfare organization or whether it is Department of Social Development, their social workers then would intervene. But we will write then a broad psychosocial report and do that referral to that social workers.
Okay, now in terms of, you've highlighted an important aspect in terms of a child. Now in terms of adults, let's take a typical scenario where you have someone or a patient that has been injured and he has severe neurocognitive impairments. What's your role as a social worker in, for example, that particular case? If you could just highlight the value that you can add in terms of bringing the family together and addressing some of the administration issues as well.
Again, it will depend on what is the role of that person, what you call, in his workplace.
So if he was maybe the sole breadwinner.
Yes, but also in the workplace, and then also in the family, and then also what were the functioning, the level of functioning of that member also in those type of systems. If it is in a marital setup where there's a couple, what is the relationship? Is that individual what you call the breadwinner, as you've just mentioned? So those are your assessments that you will do, and then you will also consult in terms of, if it's for instance in my setup, you will look at also disability. It's good that you know about what are the information around disability, and it's also good that you as a social worker update your knowledge and your skills in terms of cognitive functions. You don't,
Okay.
you're not the medical doctor, but it's always good to know what are the impact, because there are always cross interferences with regards to that. And once you've established what you call what are the impact on the social functioning of that neuro dysfunction on the member, then you will work from there. Consult with the husband, consult with the wife, consult with the workplace, even in our setup, because you need to know, and also the other multi-professional systems that needs to play a part. In this case, if it's physiotherapy, if it's the occupational therapist, the doctor, the nursing personnel. So you will get all that multi-professional teams functions in what they call involved. But family interviews is very important.
Okay, so it's also then after this particular incident, or if the patient is injured, it's about giving them the idea of role clarification.
Yes.
And giving them the status of how this person will progress in terms of disease recovery.
Yes.
And how he can be integrated back into his work environment.
Yes.
Now in terms of
And loss is also a big what do you call area.
in terms of
Yes.
grieving as well.
Exactly,
Okay.
because if you have certain functions that you have what they call independently operated on, and then suddenly you can't function anymore like that, you can't write, you can't read anymore, it's very difficult then to become dependent on this. So you actually have to grieve the loss then of that neuro functions. Yes.
Okay,
it's
so you
important.
help the person to deal with the situation.
With the loss as well, and also you need to work out a discharge plan. Are there support systems for this member if he is discharged from the hospital?
Okay.
Yeah.
So then you'll try to get the entire family, and
Yes.
you try to make contact with family if there is no family around. So you've mentioned that family plays an important role in the support structure. Now, what would happen if you're unable to contact family? What would be the next step from there?
I think it is important that we also know what are our resources
Okay.
in our communities
Yes.
as social
Okay.
workers. So once you know what are your resources in your community, you also then need to take a look at the care of this person after the medical admission, the post-discharge plan for
Yes.
this member. And then you also need to assess what you call the income of this member economically, because these places what they call will charge for the admission of this member if it's not covered by you or her medical fund. And in that way you can then apply for this member to be admitted in that special care fraternity, whether it's called a step-down facility, whether it's a vulnerable care facility, or whether it is a facility that look after mental health patients. Because if you look sometimes, if you have a neurological problem, it does impact our mental health.
Okay.
Yes, but it will be determined by the illness, it will be determined by the impact on the person's, whether it's psychologically, whether it's physically. So you will assess in all of that systems what are actually a suitable place after discharge from the hospital.
Yeah, we've just covered the aspect of the patient. Now, if you could just highlight an important aspect where some individuals actually see the social worker as a person that issues a grant or a social grant. Can you just elaborate a little bit on that?
Okay. I think that there are different levels of economical support from the government to our clients that are economically viable to get a grant. But the social work is only one component in the process of the decision making. We will write a report, for instance, on the person's economical circumstances, and we will make a recommendation based on income and expenditure. But legislation, different legislation, will actually dictate which people and based on which criteria a grant is actually issued.
So that would be a child grant
Yes.
or a disability grant. So there's different forms that needs to be completed for each particular grant.
Yes, and also again, a multi-professional team also plays a big role in who compiles which sections of those medical forms. If it's a person, for instance, that got a disability through a a road accident, then again a doctor would be involved, occupational therapist would be involved, the work supervisor would be involved in putting in inputs, a social worker. So there's a whole process with regards to who is then the final decision makers in terms of the information that has been gathered. So a holistic picture is actually gathered through all the documentations and the report, but the social worker is not the end point of
so
the decision
you are
making.
just the information gatherer, and you
Yes.
develop the reports.
And we can make recommendations.
Okay.
Yes.
Okay. Now, you've mentioned the discharge planning, which is part of the entire treatment of the patient. What about follow-up and monitoring of that particular patient? How much are you involved in making sure things are going according to plan? How often do you monitor patients as well? Obviously, it depends on that particular patient's circumstance, or if you reintroduce a child back into the home, what is the process that the social worker follows during that follow-up or monitoring phase?
For instance, as I've mentioned, I work in a medical setting, and my jurisdiction is in the hospital setting. But say, for instance, if an elderly person that requires support systems upon discharge is discharged, but you've generated now the support systems as a support in the home. Nothing then prevents you from doing the follow-up in terms of the carer. and also the functioning of the elderly person. So we would then treat that person as an outpatient, what they call a person, or we would refer that elderly person to a social worker outside for follow-up services. But normally we try to deal with that individual as an outpatient person. So yes, home visits are important to go and see how the person is functioning in the home setup, and also relationship with the carer.
Okay.
Because if you are quite dependent, there needs to be also a relationship building, trust building between the carer and the elderly. In the case, for instance, of a child that was admitted in the hospital, and we've involved the social workers from the outside as part of the statutory process. Nowadays, the outside social workers, as we like to refer, Department of Social Development, Child Welfare, they work also with the family members. Because you can work with a child in terms of that counseling, you can work with the family members, but it is always important to place a child, if it's possible, back into the community, back into the family setup. So we as the social workers in the medical setting will then liaise with the social workers externally with the Department of Social Development, and then ask them how are their what they call counseling proceeding with the family as well as with the child. If they write then a feedback report to us, and they will say to us they require this recommendations, then we will do continuous and follow up with that family if they were a part of our staff in the hospital.
Okay, so just to put it in simple terms for the viewers, what you're actually describing is the referral system that exists within tertiary hospitals and secondary hospitals down to a community-based clinic. So you'd give the referral to the day hospital or the clinic, and their social workers will then provide you with feedback because the patient is discharged from a secondary or tertiary hospital. So that's one of the mechanisms that you actually use to follow up.
And if you look, for instance, at a child that has been exposed to any form of child abuse, play therapy is important. So we will also would like to see that play therapy is involved for that child. And then also we would also like to see that psychologically that the child is also consulting a psychologist, because there is a lot of emotional things that needs to be worked through, and also a lot of issues in terms of adjusting back into the family setup, and also to determine, who are the perpetrator, and also ensure that the perpetrator are also involved in counseling if the perpetrator, what you call, is part in the family setup and not what you call in a correctional setup. Because in there, the correctional service social workers will then continue with further counseling on that level. So you cannot just focus on the follow-up services of the victim, but if you can, you must also involve the perpetrator.
Now, another aspect I think it's important is when you have a terminally ill patient, a social worker is also one of the core individuals that forms part of that multi-professional team. So what services can you offer the family, and how can you assist that particular individual that is terminally ill?
That is also a specialized area, because we look in terms of that area in terms of palliative care, hospice, and also rehabilitative care. So in that setup, it's very important to determine also if it's terminal, is that you need to prepare the family members, and not just the member, but the whole family needs to prepare. And also if there's a period, if that member is discharged from the hospital, who is actually going to take care of this member? And the family also need to make sure that, sometimes your finances, last will and testament.
Yes, I was going to ask you, so do you actually assist the family, or what's your role there?
We ensure and we ask, do they know where are those critical documentation? And we don't, for instance, link them, because we regard that as a very personal thing. But we would just like to know that the family knows where those documentation are. But the loss and the preparation, all of that are very important, and the grief, and again the support structures, but also who are the family members support structures. And if it's again an elderly person, to see also if that elderly person have a support structure, if it's a husband or if it's a father, and if it's the mother, are the children supported? Sometimes it's a single parent that passes away. Who's going to be the support systems for the children? So those are our roles in terms of bereavement counseling, loss counseling, generation of support structures if there is none, and then also to facilitate the process of linking the family to other support structures and also support groups.
Okay.
Yeah, for loss.
So in terms of support groups, where would you refer the family to? Are there any particular ones that you'd look at, or would you just make the necessary contact with the community and find out who the support groups are?
We will sometimes contact the churches, because a lot of churches have a lot of support groups for their different churches, because our population is very diverse.
Okay.
So you also need to link up based on whether it's based on religion, which cultural practices, and link up with how do those type of communities or those special preferences, how does it play out into how people manages their grief. Some people also don't like to be part of a group. So you also need to work with the assessment on what are the likes and the dislikes and the preferences of that specific individuals in that family that you're dealing with. But your church is a good departure point to determine whether they are support groups. But sometimes in the hospital, nothing also stops a social worker, if there's more than one family that's going through the same problem in commonalities, into have a support group for that specific hospital.
It seems as if in today's society the value of the social worker has improved compared to yesteryear, where the social worker was taken for granted. What's your opinion about that?
I think that social work as a profession has sort of capitalized really on the needs of people, but also onto their roles. I think previously people only viewed social workers in their roles of removing children. But nowadays, social workers are policymakers. Nowadays, social workers are change agents. Nowadays, social workers are advocates. Social workers are mediators. So there are different roles that social workers play in community. And people realize that social workers are not just there basically in the association of yesteryears, dishing out food and giving grants to people.
Yes.
But that social workers actually are professional people, and that they are flexible and they have compassion. But social workers also have an activist role on behalf of communities that are in need.
Okay, that's very well said. Now, how do people get in contact with a social worker?
We are broadly, I would say, available at any hospital. There is a social worker. If you look at our Department of Social Development, they've got the intake desk. If you look at our child line numbers, resource databases that we have available, I think you can just nowadays, we just make it very easy. It's our Google, you can just Google where can I find a social worker.
So, just to inform the public, you don't need a specific referral like from a medical doctor to a specialist. You can access it from a primary entry point as well.
Yes, we have what we call self-referral, so that will be regarded as a self-referral. But again, if you're going even to a normal clinic, that nurse there at that clinic can also provide you with a referral to your closest hospital. So it also depends on which vicinity that you work. If you look at Tygerberg area, Tygerberg Hospital's got a social worker. If you look at social development, again in different areas, if you look at child welfare, if you look at Bedisa, different areas got different social workers, and the NGOs directly in the communities of where our people are, they also providing a beautiful service to our members. And sometimes people downrate them because they're functioning maybe in different homes in communities, but they are the arms and the eyes sometimes of the bigger social work department.
It's exactly what you said, because your social worker originates from the community. They understand the needs of the community, and then they provide it to the NGOs and say, this is what's happening in the community and this is where we can add value. Is there any particular message that you'd like to give the viewers before we end off regarding social workers and the discipline of social work?
Well, I think that sometimes our value is underrated. If you look at the education of social workers, I always say there are very few professions that prepare people to have life skills. And I think that is a profession of social work. But if you look how they are remunerated in this country, and I think sometimes all over, we don't actually really value the contributions of social worker. And therefore sometimes the status are sometimes dependent on the economical income and how social workers are remunerated. And that is why also the view of the position of social workers also downgraded. But if I look at my colleagues all over in the profession of social work, they are doing an excellent, stunning job.
Rewarding as well.
Yes, it is very rewarding, because I think when you give to people, you are not the only person that is receiving something. From all your clients that you're working from, you learn something, you journey with them, and as much as they are passionate about their problems being solved, social workers are passionate about resourcing avenues to solve that problems in partnership with communities and their clients. It's never just the social workers on their own, it's always in partnership with and the participation of our clients and our communities.
Chrystal Radebe, it's been a great pleasure having you on the show. So thank you once again for coming to the studio, and we hope to see you soon. Thank you very much.
Thank you.
So, thank you for watching. Stay tuned for another episode, same time, same place, next week.